Please subscribe to our channel, Insight, for more updates. Risk factors for type 2 diabetes. Family history. Your risk for developing type 2 diabetes is high if one of your parents or a sibling has it. When combined with diabetes triggers like your diet and exposure to certain viruses, your risk for developing diabetes increases. Though you cannot do much about the genetic predisposition, you can certainly strive to avoid the triggers. Race or ethnic background. Apart from family history, people belonging to certain races or ethnicities are more prone to developing type 2 diabetes. Hispanics, African Americans, Hawaiians, Native Americans and Asians are at an increased risk of developing diabetes. So, if you are of African American, Asian, Native American or Pacific Islander descent, it's time to make lifestyle changes to reduce your risk. Age. Your risk of type 2 diabetes increases as you get older. Most often, it occurs in middle-aged adults, say after age 45. This can be due to the fact that people tend to exercise less, lose muscle mass and gain weight with increasing age. However, this type of diabetes is occurring in children, adolescents and younger adults more and more nowadays, mainly due to unhealthy lifestyle choices. Health experts recommend all adults, beginning at age 40, have their blood sugar level checked every few months. Early diagnosis is key to preventing or managing type 2 diabetes. History of gestational diabetes. If you develop diabetes during pregnancy, known as gestational diabetes, then you are at an increased risk for type 2 diabetes. Also, giving birth to a baby weighing more than 9 pounds increases your risk of type 2 diabetes. This is a modifiable risk factor, and you can decrease your risk by leading an active lifestyle and maintaining a healthy body weight. Overweight or obesity. Being overweight or obese increases the likelihood of developing type 2 diabetes. Being overweight stresses the inner part of individual cells called endoplasmic reticulum. When the endoplasmic reticulum has more nutrients to process than it can handle, it causes the cells to dampen down the insulin receptors on the cell surface. This leads to persistently high concentrations of glucose in the blood. Moreover, if your body stores fat primarily in your abdomen, your risk of type 2 diabetes is greater than if your body stores fat elsewhere, such as your hips and thighs. One good thing about this risk factor is that by losing 5 to 7% of your body weight, you can cut your risk of developing type 2 diabetes. Physical inactivity. Physical inactivity is another top modifiable risk factor for type 2 diabetes. The less active you are, the greater your risk of type 2 diabetes. Moreover, physical activity helps weight loss, uses up glucose as energy and makes the cells more sensitive to insulin. Aim to do 150 minutes of moderate intensity aerobic physical activity, 75 minutes of vigorous intensity aerobic activity or a combination of the two with muscle strengthening at least 2 days per week. High blood pressure. High blood pressure can cause significant damage to the cardiovascular system, and untreated high blood pressure can even lead to the development of diabetes. Also, women who have gestational diabetes are more likely to have hypertension. However, women who manage their blood sugar levels during pregnancy are less likely to experience hypertension or type 2 diabetes. The combination of hypertension and type 2 diabetes is really bad, as it significantly raises your risk of having a heart attack or stroke. If your blood pressure is running high, take it seriously and follow your doctor's advice to keep it in check. Abnormal cholesterol levels. A low level of high-density lipoproteins and high triglycerides can increase your risk for type 2 diabetes as well as cardiovascular disease. However, people with naturally lower LDL levels were less likely to develop heart disease but were also slightly more vulnerable to type 2 diabetes. To maintain healthy cholesterol levels, a healthy eating plan, consistent aerobic physical activity and a healthy weight can help a lot. Prediabetes. Prediabetes, a milder form of the condition, is an obvious risk factor for developing type 2 diabetes. Prediabetes is defined as blood glucose levels above normal but below diabetes thresholds. Prediabetes can be easily diagnosed with a simple blood test. If you have it, get more active and lose any extra weight. Also, opt for a healthy diet and follow the suggestions given by your doctor.